It's snatched. Actually, I'm size waist 26.
I've always wanted a slim belt, definitely, because I don't have that much snatched waist.
Go to the gym, babes.
I don't feel like it's really necessary.
Terms like snatched and what waist have taken over the streets of body goals. But at what cost? What really are the health implications of slimming belts? Welcome to Health and You. My name is Maria Jones. Enjoy.
Tummy trimmers are fitness tools that are used to be able to work around the belly area, fat around the belly area, which many people will call as street language as tires. So for the corsets that women may use, some put under the clothes, some will wear them when they are going out and those kind of things.
Yeah, for a slim babe like me, I mean, that's an asset.
Fat around the belly area medically is called visceral fat. Visceral fat is, number one, is a health risk. Just apart from the cosmetic appearance where men will have an issue, how they look with the tummy fat, it's a health challenge. Why? Because it poses a risk of high cholesterol levels. It keeps you at risk of having things like obesity. It keeps you at risk of having insulin resistance. It will keep you at risk of hormonal imbalances, even for women, for example.
For your waist to be snatched using the shorter way, you have to wear it constantly when you're working, when you're doing your chores at home. So you just have to be in it.
It helps women who have given birth. It's more helpful to them because their tummy, reducing it. But for a person, I feel like you need to go to the gym because it really doesn't help that much.
The corsets may give you the cosmetic appearance that it will put you have a small tummy. Physically, you look like the tummy is gone. But medically, it does not have much effect on lowering your tummy. You just hide it for the gram. People will see you look nice, flat tummy.
There's some type of clothes that you can't wear. I can wear a tumbo cut and still see my waist, but for them, they don't have that privilege.
So uncomfortable, and then it's friction. You know, you can't work conveniently in it.
The moment you just take it off, you're like, woof, it's done. I'm free. Yeah. It's like you're in a cage. You might find the slimming waist is constricting the internal organs.
Sometimes it puts compression and pressure around your area. You may have issues with respiratory issues because when you have tummy fat, for example, then it occupies a little bit of the volume where the diaphragm, for example, is. So once again, you compress pressure on it, then may push your diaphragm, for example, up. Then you start having issues like respiratory distress. For women, for example, they may have sleep apnea where you're snoring at night. You may have difficulties in breathing. People who have things like asthma may be at risk of having an attack because of that compression on the chest. Remember, when somebody has asthma, for example, they don't need such compression things. There are people who have gastric problems. Maybe you have ulcers, you have gastritis, then you apply more pressure, then it makes that effect worse. So again, if you're having gastric issues, then you don't want to put that pressure on it. There are people who have things like hernia. Then I have a hernia, then again I apply pressure, then it will make the condition worse.
Exercise. Instead of sitting there and eating and expect your stomach to flatten.
You can do press-ups, sit-ups and all that.
There's some drinks, ginger and garlic.
They should just love themselves the way they are because the belt is really bad for their health, first of all, because your body needs to breathe. You need to breathe. You need to feel confident that comes from inside.
There are different options to be able to manage your waist medically and of course cosmetically. There are people who prefer a liposuction where they'll remove the fat through liposuction. Though remember, it's not long-term. Liposuction will just remove the fat but does not solve the issue where the fat comes from. There are options like, for example, there are fat-reducing medications where you can take yourself for 3 weeks or for 1 month. They're injectables where you can inject yourself, and these weight loss medications, they work by lowering your appetite. so that you ingest less. So you're always feeling full. So the body will naturally burn down that fat. So these medications can be prescribed to you by a health practitioner and then you are followed through. But it's a regulated thing as opposed to that compression. Again, there are long-term things like bariatric surgery. You can do a bariatric surgery where bariatric surgery is a reduction of the volume of your tummy, where you go through a medical surgical procedure. They reduce the volume of your tummy so you ingest less and feel full faster. So the body compensates for the difference by breaking down the excess fat. Those are extreme measures, but there are also lifestyle changes, for example, which you can adapt, like in your diet, doing less of processed foods, doing less of sugary drinks, doing less of fatty foods, and doing more of fiber and vegetables. So that will help you to manage that fat around the abdominal area.